So for my program, currently we have in-home family services, and we cover about 45 counties here in Nebraska. So we're all over the place, and primarily we're serving probation kiddos, but we do take DHHS kiddos as well. And this is a good slide too. And so we go into the home. We're really skill focused on the family. So we work with the parents. We spend some time with the kiddos, and then we really try to pull that together too, so that whole family, as a whole, can be successful. So we set some really individual goals for that family to try and get them to success. So we kind of meet them where they're at and build off their strengths. So we work with all the kids in that home as well, not just that identified kiddo, so that we can get kind of everyone on the page, and what we're teaching the parents and then what we're teaching the kiddo, it all kind of links together. So then we do visits separately, but then we're pulling them in for visits together as well. And usually we try to do about 4 to 6 hours a week in the home. We are available for crisis calls, so we're responding to the homes. If they are reaching out to us, we go to the homes. Typically, we're responding for more things like if there's any suicide ideation, things like that, that we really may need to go out and assess a little bit more, kind of do our assessment on that kiddo and kind of give some coaching and guidance from there, whether they might need to go to Richard Young or something like that. So they have that support and guidance. And then our model is replicated too. We are evidence-based. So there is replication of our model going on in an additional 23 counties by other agencies within Nebraska for our in-home family services.
Okay, and sorry to skip around here just a little bit, taking you back. So our mission here, as you can see, we have the child in the middle, we kind of tailor to focus on that child, because we know that when we're working with families and children, helping them just springs forth to help the family overall, and that springs forward to help the community overall. So our mission is to change the way America cares for children and families. And our vision, everyone would like to see, is an America where every child and family receives the effective, compassionate, and care that they need to be healthy in body, mind, and spirit. This is just kind of a big overview of all of the services that we focus on. So Laura talked about her in-home program. We have our, which has our care coordination in-home. We're going to skip ahead here a little bit. There's our foster family services.
And through all these services in Orange, we've served typically about 1,000 kids per year in these different programs with the orange stars on them.
In our different locations, we have a Duncan Day School, and then Grand Island, North Platte, and Kearney. And we have our in-home family services, foster family services, care coordination here in Grand Island, Kearney. If I forget any, throw in Kearney, in-home family. We have our LIFT program. And care coordination, we kind of cover through there. So travel for that, North Platte, in-home family services. Did I miss any?
No. Nope.
Okay. Kind of went over that. So collaboration. And then just a little bit more about our Duncan Day School. So what that offers is specialized, individualized education for children that are, just really, they have chronic behavioral issues, and they offer more one-on-one individualized services with these kids. And they have the capacity to serve around 40 students and grades K through 12. So you talked about in-home. So care coordination, this is, I guess, my baby, as you call it, but we work with families, we take assessments, we see what they need, and we just connect them with services and supports, and just focus on monitoring those services once we connect what those needs are, monitoring those services with them. We meet with them typically once a week for at least an hour a week, and ultimately our goal is to work on that empowerment piece where the family is independent and they know how to navigate these resources on their own.
Currently, we don't have a behavioral health clinic. We do have the space out there. It was up and running last year, but there was some turnover in that. So we are actively recruiting right now for positions to get our behavioral health clinic up and running again. It did serve a lot of kids. It offers a lot of benefits. So we won't spend a lot of time on that, but we're hoping to get some more people back in there and have that service up and running for the community again.
Okay, foster family services. They served ages 0 to 18 with types of kids from juvenile justice or child welfare involved kids. They recruit, train, and support foster homes, training and licensing. They work with families. And so greatest need for homes who are willing to care for school-age children and siblings. Trying to think, did we forget anything? Is there any questions?
And we do have LIFT too. I don't know if anyone's heard of LIFT. So we have school support specialists that are currently in schools that are working with kiddos that have been maybe referred out of the classroom due to being disruptive or something like that. So in our schools too, in North Platte, we're in Adams, Jefferson, and Lincoln Elementary. And then in Kearney, we're in Horizon and Sunrise currently. So we have some school supports there. They're there all day. They're working with kiddos that have been referred out of the classroom to get them back into the classroom, get them back to where they need to be, refocused, and then continuing on their schoolwork. So that's been really great as well. And some of the teachers have also been trained themselves in well-managed schools, which kind of then ties together because then they know what's going on and kind of what we're working on, so they can do some of that stuff in the classroom as well as we're out working with getting kiddos back into the classroom and getting them back to where they need to be.